My philosophy of patient care, first of all, starts with being a good listener and trying very hard to understand what it is that the patient needs from me. And by taking good history and listening not just to them but also to their family members, if present, then I make sure that I'm going to help them in the best way possible to make them feel better and have a better life. I grew up in a small town in northern Iowa, and then I went to the University of Iowa for an undergraduate degree, and then was accepted into an MD PhD program there, which I then completed, including a PhD in physiology and biophysics. As I was an undergraduate, I took a course in cellular electrophysiology, and I thought it was so very interesting how nerves and muscles worked, and that they were all electrically driven. And as I went into medical school and got an MD and PhD at the University of Iowa, I then went to the Mayo Clinic with the intention to become a neurologist. But while I was there in my very first year, I was assigned to 6 months of cardiology. I then learned about cardiac electrophysiology as an actual specialist, and I thought that was so very interesting that I asked the people who ran the Mayo Clinic if I could please change my major, and I changed to internal medicine and went on to study cardiology and cardiac electrophysiology. My passion is always about trying to not only help people with their cardiac and medical condition, but I also want to help them emotionally so that they not only come away feeling better physically, but they also feel better emotionally because they understand what is wrong. If they have inappropriate fears, I can help them worry a heck of a lot less just by giving them not only good treatment, but a good education. I was a guitar player, and so when I was younger and in high school and college, I actually played in a top 40s band, various locations around Iowa, homecomings and proms and some college parties and things. So I truly love music, and my wife, however, is an extraordinary musician with a beautiful voice and a very gifted piano player, and I'm simply not in her league as far as my abilities as a musician, but I do enjoy music, and I have children who also enjoy then music as a hobby. My mission as a physician is to take very good care of patients, not only from a medical perspective to make sure that I've taken care of their heart condition, but also from an emotional perspective so that they feel better and have a happier, nicer life because of the care I've delivered.